Hi guys, I'm Gladys.
And this is Mary.
And together we are Bristol Babes, here to save the day, sterilize the germs away.
First thing in the morning, you want to check the detergent levels in the hydrant. Make sure there's enough. Then we move on to the ultrasonic. You would start by adding a detergent tablet. These are added in daily. Then you would fill up the ultrasonic to the appropriate water levels using distilled water. This is done daily, as water is drained every night or when visibly soiled. Next, we would move on to the autoclave. Check water levels. Make sure the water reaches the green line. If water does not reach the green line, add water. Next, we move on to the statum. Remove the lid, lift the filter, and check the water levels. Add distilled water if needed. You know you have enough water in the statum when the filter is slightly floating. The filter helps catch debris and impurities. Next, check the water reservoir. Make sure water is below the indicated line. Drain if needed, but make sure to leave a little bit of water so the machine doesn't overheat. Prior to closing your cassette, make sure all instruments are in order and none are sticking out. Remember when handling dirty instruments or handpieces to always use utility gloves and remain in full PPE, including eyewear, mask, and gloves. When transporting dirty instruments from the treatment room to sterilization, remember to be in full PPE, including mask, gloves, and eyewear. Place transport bin in red zone. Remove dirty gloves. Wash hands and re-glove. Remain in proper PPE as it is essential for our protection when handling contaminated instruments. After re-gloving, we proceed to select the appropriate sized pouches that will adequately fit our instruments, handpieces, and cassettes. We then grab our Sharpie and proceed to fill out each pouch with the appropriate information, including our initials, today's date, the load, and the machine that was used. In this video, we use pouches, but if you are using wrapping paper, make sure to use the envelope wrapping technique to properly ensure that your cassette is wrapped. Also, use adequate tape. Once the pouches are properly labeled, we will place our utility gloves back on and proceed to remove the transport bin out of the red zone. Once our transport bin is retrieved, we will walk it over to the counter, open the bin, and proceed to retrieve the instruments. We retrieve our cassette and place it inside the hydrum. The hydrum runs for approximately 27 minutes at 180 degrees. The hydrum helps pre-clean the cassette of any blood, tissue, debris, and bioburden. We close the door shut and hit the R2 button to start the load. The hydrum automatically cleans, rinses, and dries the cassette. We then proceed to grab all of our loose instruments and place them in the ultrasonic. The ultrasonic will run anywhere from 4 to 16 minutes. The process time depends on how visibly soiled the instrument looks. You press the button and the ultrasonic will start. Then we grab our handpieces and take them to the handpiece oiler and cleaner. The oiler and cleaner typically run for about 2 to 3 minutes. Screw the handpieces into the appropriate slot and make sure they are tightly screwed in there. Make sure the handpieces go together. Remember, handpieces should never go in the ultrasonic or the hydrum. Once handpieces are tightly screwed on, proceed to select the button that contains a handpiece. While our instruments are being pre-cleaned, remain in utility gloves. Proceed to grab a cabbie wipe. Wipe down our transport bin, lid, and counter. Once our transport bin is all clean, we close it and we transport it to the blue zone in the sterilization room. We come back to wipe the counter and all surrounding areas where our transport bin was located. We keep our utility gloves on to unscrew each handpiece from the oiler and cleaner. Remember, these instruments are still dirty. We unscrew each handpiece, walk it over to the counter, and sit them on top of their designated pouch. Once the ultrasonic is done running, we can retrieve our loose instruments. You can use the clamps or just simply retrieve the basket out of the ultrasonic. Remember to thoroughly rinse the instruments and remove all cleaning solution. This also helps reduce bioburden. But remember to handle all loose instruments with utility gloves as they are still dirty. Place instruments in drying rack. Time varies. Remove when instrument is visibly dry. Place the handpieces in the appropriate pouch. Remember to keep utility gloves on as the handpieces are still dirty. When retrieving loose instruments from the drying rack, make sure they are visibly dry. This helps prevent wicking. Place instruments inside an appropriate pouch. Remember to keep your utility gloves on as these instruments are still dirty. Retrieve cassette from hydrum. Place cassette in appropriate pouch. Once all instruments are in their appropriate pouch, utility gloves can be removed to facilitate sealing the pouches. Remember, do not touch the instruments as they are still dirty. Remember to seal along the dotted line for all instruments. If at any point you forget a step or a procedure, there are indicators inside sterilization in the cabinets. This helps ensure that all instruments go through the proper sterilization technique and are safe to use for patients. To finish the sterilization process, we will place our cassette and loose instruments in the autoclave. The autoclave runs for approximately 45 minutes at 170 degrees Fahrenheit. Make sure all the pouches are facing paper side up and are spread apart. Make sure to push up and properly seal the autoclave. Hit pouches and hit start. When starting the autoclave, one must fill out the sterilization log sheet. This includes your name, the date, the time, the temperature, the load, and the machine that was used. You must include whether you use pouches or if the instruments are wrapped. The log will also ask you to confirm if the indicator turned colors. That is something you fill out at the end. Gently pull the statum out and retrieve the container. Typically, a statum runs for about 12 to 14 minutes at 275 degrees. Place the hand pieces into the statum paper side down. Also, make sure to leave space and make sure nothing is overlapping. Close the container back up and make sure to pull the lever over the box. Statums have a USB chip, meaning nothing needs to be written down. Everything can be seen electronically. Press the correct buttons. Since these instruments are in pouches, we would hit pouches and start. If the dentist needs an instrument immediately, they can be placed unwrapped. Prior to retrieving the instruments out of the autoclave and statum, make sure to open up the machines using utility gloves, as the outside of the machines are still dirty and the only thing sterile are the instruments inside of the machine. When retrieving the instruments, make sure to check the indicator strip in the corner of the package. If the instruments stayed the same temperature throughout the sterilization, the indicators will have turned brown, as can be seen in all pouches. Place in the blue sterile side of the sterilization room to ensure that they stay away from all other contaminated instruments. Biological monitoring is done weekly. Use 2 vials, one placed inside sterilizer and the other is the control vial. Label using initials, date, and load. After processing, crush the vials in the indicator's opening until you hear a pop. This allows the spore strip to be surrounded by fluid. Write down all the information. Also, write down your name, date, initials, and run of the day. Place both vials into incubation for 10 to 24 hours. And check the detergent levels in the hydrum. Make sure there's enough. Next, we would move on to the autoclave. Check water levels. Make sure the water reaches the green line. Next, we check the statum. Make sure the water isn't overflowing by making sure it doesn't go over the max line. But make sure to still leave some water so the machine doesn't overheat. Next, we pull out the statum and make sure it has enough water. If not, add distilled water. Remember, you know you have enough water if the filter is slightly floating. Next, we move on to the ultrasonic. Remember to drain out the water daily, unless it is visibly soiled. Drain all the water out and ensure there is no water left by the end of the day. Finally, at the end of the day, make sure to completely wipe down all surfaces, all equipment before the night is over. Thoroughly wipe down all the surfaces. Lastly, remove all PPE as the sterilization process has come to an end. Start by removing your gloves, then your PPE, then your mask and eyewear. Once all PPE is removed, make sure to wash your hands thoroughly one last time before leaving the sterilization room. Congratulations, you have mastered the sterilization process.